Today we're going to look at tibial internal rotation. Our tibia needs to be able to internally rotate and externally rotate to be able to unlock and lock our knee when we're going from a straight to a bent position and back to being straight. The other thing that can happen is that if we don't have that full range of motion, just like any other joint, we're not going to be able to find that mid-range to be able to stabilize from. So what can happen here is that we can have compensatory patterns down the chain because of what is going on in our hip. So when we go to step forward on that leg, the femur can have a slight internal rotation due to glute weakness, and that makes our foot and everything collapse in. But because we don't want to be falling that way, our body will then compensate and turn the foot and tibia out here. That can then result in a locked supinated foot that will either kind of teeter down to try to find that big toe or force it to get down and make that first ray hypermobile and create a bunion and a big toe that kind of collapses in with it. And it can also create pinching on the inside of your knee. This can be seen from standing a lot of time if you noticed when your knees point forward and your foot has the tendency to be turned out. Or you try to correct and put your feet forward and then your knee tends to turn in. So what we can do here is we can do an assessment in sitting to see if that is a range of motion that needs to be improved upon, then do a mobility drill to help with that range of motion, and then reuse our seated test here to see if our range improved and if that was a productive thing for us to do. If it was, then working on this can help eliminate some of that twist that's happening down in the middle here to then set up, okay, how we can load through our feet, how we can load through our hips, and then strengthen that pattern to correct it from collapsing back in and having that happen again. So what we'll do first is we're going to sit down and you're going to take something slippery, so I just have a sock here, and we're going to put it underneath your foot. We're thinking here that with this tibial internal rotation, we're making sure that it's the actual tibia that is rotating in and not your hip and not your foot turning in with it. A lot of times people end up compensating from those two places to try to make up for that movement, and it's defeating that purpose. So we're putting it on something slippery here to make it easier to move around. And I'm going to make sure that my knee stays pointed straight forward the whole time. Then I'm going to think as if there was a dot on the front of my shin, and I'm going to slowly rotate my shin in, keeping my entire foot flat on the ground and not letting my knee move. And then I'm going to come back out. And sometimes it's just a matter of kind of connecting with this, and sometimes it's that there's some restriction that needs to be kind of cleared up a little bit. We're also thinking about the inside hamstring muscle is the one here that helps with that turning in versus, oh look, I've turned in, and then that's happening more from your arch in your foot. If people do that a lot of times, you'll end up having a complaint of like arch cramping when you're going to do it, but it's all about making sure that big toe stays down. So what we're looking at for here is not only how far you go, but what that ease of movement is, and full range of motion is that your pinky toe would go past the middle of your knee. So then we can always compare to the other side, because sometimes comparing to another side can help you feel the difference of what might it feel like on one side versus the other, or what's normal or not normal. And you can see that I have a lot easier movement on that left side compared to my right side here. It can still get there, but it's just a little bit stiffer and has a little bit more restriction to it. So now what we're going to do is we're going to look at the mobilization. So with this one, you're going to take your chair, and I'll show you from a couple different directions here. And you're going to put your foot up on the chair. You're going to grab your shin just below your knee. So I'm taking a nice meaty grab. My thumbs are behind my knee here at the top part of my calf. And I'm going to give a little bit of a twist. As you're doing this, at no point do we want any knee discomfort or tension when we're doing it. That's very important with this. So we grab here, I'm twisting in. So this is creating that tibia internal momentum. What we have to make sure is when I go to do this, that I don't take the rest of me with it. That defeats the purpose. So I'm going to grab here, I'm going to twist in. Then for my hip and knee here, I'm going to think about pushing my knee out, all keeping that big toe down, because again, we don't want to then compensate overly this way. So my shin is twisting in, and then my knee is turning out to create that mobilization. So I've got my big twist in, I'm making sure my knee is pointed straight ahead. I'm going to keep my heel heavy, and I'm going to slowly lunge forward as far as I can, keeping my heel heavy and my knee pointed straight ahead like a headlight, and then I'm going to go back out with it. So I'm keeping that twist the whole time. You're also watching in your hips how people will try to go further is they'll go forward and then they'll swing their hips out to the side. So you're thinking of your hips pointed forward like headlights and that knee pointed forward like a headlight. So I'm grabbing here, I'm twisting in, I'm keeping my right heel heavy, and then I'm slowly shifting forward, keeping my hips square to the front, my knees square to the front as best I can, and then back out, pretending like you have that $100 bill underneath your heel that you don't want somebody to steal with it. Going really slowly can help you kind of milk and work into that movement, versus if you go really quickly, you might miss those compensations. So I'll show you from the side here. So as I'm going to do this, we're square to the front, and then I'm making sure when I lunge forward that I don't roll into an anterior pelvic tilt, but think about that reaching to the underneath side of my sit bone, which is going to help keep my heel heavy and help the front of my shin stay as relaxed as possible and the front of my hip stay as relaxed as possible. Every once in a while you'll get people that complain of some discomfort here in the front side of your hip, and most often they're kind of stabilizing themselves with their hip flexors, and so we're trying to relax that. Think about that reach to that underneath side, trying to keep that ankle relaxed, which will help keep that hip relaxed and really get that mobilization from the back side of your calf here. Usually I'll have people do it about 5 to 10 times for it, and then we'll come back and we'll retest our range of motion. So I'll sit back down, put the slidey sock underneath my right foot, knee stays pointed straight ahead, and then I'm going to rotate just that shin in, keeping the ball of that foot down, and then back out. So you can see that it can go a little bit better, and then to me, I can feel, oh, that just slides a little bit more easily than it did beforehand. That tells me that was a productive mobilization to do, and something to do to help make then my loaded movements into a squat, a lunge, or anything else easier to do without fighting myself as much. It's also can be a great thing then to come back to that single leg stance test and see that and feel, am I able to bounce a little bit better? Do I feel a little bit less of that twist? And it's not the end all be all, but it's a good starting place as kind of a palate cleanser to work on one quick little move. And then as you work on correcting the foot and hip movements, that knee is going to keep being happy and quit being stuck into that excessive external rotation, and you won't have to keep that mobilization in the mix. But hopefully that gives you a little something to start out with and explore. And you can also see, oh, now when I go to stand up, can I keep my feet and knees pointed straight ahead versus having that twist that tends to happen when you're trying to correct otherwise with it. So try it out and let me know how it goes.